We tried also to look at other factors and see if they are predisposing to infraposition. And when we looked at age, sex, and long face, we could not find that they are reliable to predict future infraposition. What we did find, however, was that more extensive positional changes was found when the lower anterior facial height was larger than 70 millimeters, when the implants were not in occlusion, and when trauma was not the etiological factor to the tooth loss. So, to sum up this lecture for today, I would like to give you a little take-home message. And I would like to start off with the patient selection, because when treating these young patients, we really need to make sure that we're treating the right patients so we get a treatment that can actually work both short time, but also long time. So if we look short term, what we should look for is that we should take care and see what smile line the patient has, what kind of biotype the patient has, how wide is the alveolar crest, and is there a good space for the implant. If we look at the long-term results instead, we didn't find any correlation between age, sex, and facial type. However, the clues that we found to what can be an answer to predict infraposition are these three: the lower anterior facial height, the implant not in occlusion, and that the etiology for tooth loss is not trauma. However, these results have only been found in one study, and they need confirmation from further studies before we can start to actually use them.